Hello and welcome to today's 411 as we continue our diabetes awareness. Today we have with us Dr. Alaire Khan Fraser here to talk about the medical aspect of diabetes. Welcome to the program, Dr. Fraser.
Hi, Ms. Lechton. Thank you for having me.
The pleasure is mine. Now tell us what we need to know about diabetes.
Well, more simply put, diabetes is a chronic illness during which the levels of sugar remain high in your blood. We all have an organ called the pancreas, and the pancreas secretes a substance or hormone called insulin. So what insulin does is that it moves sugar from your bloodstream into your cells where it's either stored or used as energy. What happens in diabetes is that there's a problem either with insulin production or with how cells or tissues are sensitive to the insulin. So the levels of sugar remain high in the blood.
Wonderful. So what is type 1 diabetes and how do you get it?
All right, so type 1 diabetes is basically what we call an autoimmune related condition, meaning that, or type of diabetes, meaning that there is an abnormal trigger to an individual's immune system. And what happens is that there is an immune-mediated destruction of the cells in the pancreas that produce the insulin. So for these individuals, it tends to affect the younger age group. So what happens for these individuals is that there is little to no production of insulin. And then, as I mentioned before, the levels of sugar remains high in the blood.
What about type 2?
So for type 2 diabetes, these persons do produce insulin, but what happens is that the cells or tissues are not as sensitive, so they're what we call insulin resistant. So if the cells are not sensitive to the insulin, then the sugar does not move from the blood into the cells. So again, the levels of sugar remain high in the blood, and hence diabetes.
And how do they get type 2?
All right, so the type 2 diabetes, we commonly see that in the older age group, in persons, say, over 45 years. There are common risk factors for diabetes generally, right? We talk about non-modifiable risk factors such as a family history of diabetes, or, as I mentioned, also in persons age older than 45 years. There are also modifiable risk factors. What I mentioned before, sorry, non-modifiable. Modifiable risk factors such as if somebody is overweight or obese, if you have an unhealthy diet, for persons who have a sedentary lifestyle, so not very active, not much exercise. Also in individuals who, for example, have high metabolic risk factors, high blood pressures or high cholesterol levels. I must also mention another type of diabetes as well called gestational diabetes. So you have type 1, type 2, also gestational diabetes. This type can occur in a woman who's otherwise healthy, but she develops diabetes during pregnancy. And what tends to happen for this particular type is that it's an issue mediated by the placenta when there are certain substances or hormones that are produced that cause the cells to be less responsive to the insulin. So again, the level of sugars remain high in the blood.
So how does diabetes affect the body?
All right, so it acts from the level of the blood vessels, right? So there's damage to the blood vessels. And what can tend to happen over time, you can have issues where there is damage to the eyes or the blood vessels leading to the back of the eyes called retinopathy. And that can lead to poor vision or even vision loss. You're at higher risk for heart disease, heart attacks, even stroke. There's also kidney disease, damage to the vessels in the kidney disease. That's how individuals would end up, unfortunately, on dialysis. Also, there can be damage to your nerves, leading to what we call a neuropathy. And what can tend to happen is that they can have numbness to the hands or feet. And especially with numbness to the feet, this can lead to issues. For example, an individual who's diabetic who has a neuropathy, the feet are numb, they could have a wound, unaware that the wound is there. The wound stays there for some period of time, it becomes infected. And by the time they realize that there is an issue, it's kind of too far gone, there's a very bad infection, and sometimes that may lead to amputation. So that is probably the most visible complication you probably will have in terms of persons who have an amputation of a digit or say a limb.
Okay. Are there any early warning signs that we could look out for?
Yes, definitely. In terms of warning signs of diabetes, There can be increased thirst, increased frequency passing urine, also weight loss. An individual may have poor healing wounds, just generally feeling malaise, feeling unwell. Specifically for women, you can have recurrent urinary tract infections, recurrent yeast infections, and for males may have sexual dysfunction or erectile dysfunction, and that may be an early warning sign of diabetes.
Okay, can it be prevented?
Yes. As I mentioned previously, there are certain risk factors. So if you have, for example, a family member, parent, or sibling who has diabetes, it's not to mean that you're condemned to having diabetes as well, right? And I mentioned some risk factors before. So if you're overweight, we say work on weight loss. What's the weight appropriate for your height? If you have an inactive lifestyle, again, start exercising, adopting a healthy diet. Positive health-seeking behaviors. So, for example, again, if you have a strong family history of diabetes, not waiting until you're feeling ill or having symptoms. God forbid if you do develop the condition, but actively seeking medical care as a wellness check, so checking to see if everything is okay, checking to see your sugar levels are okay. So by addressing risk factors, really that really goes a far way in terms of preventing this condition.
No, I heard you speak a lot about, wounds not healing. Why, when you have diabetes, it affects the way your body heals itself?
Again, it boils down back to our immune system. So how this condition affects our immune system, it tends to make it a little bit more sluggish. So it doesn't respond as probably vigorously to mounting a response if there is any sort of infection. So that affects the whole process that our body will go through in terms of if you have a wound or if you have an infection, how your body will normally respond to it in a healthy individual in terms of what would cause a wound to heal in a healthy individual.
What about
more immune mediated process?
What about coping? Do you have any tips that you can share to help persons who are affected by diabetes to help them cope or manage their disease better?
Well, although diabetes is a chronic, we call it a chronic disease, so that basically means that there's no cure. But what I always advise my patients is that it can be managed, it can be controlled. It's not, even if unfortunately you've been diagnosed with a condition, it doesn't mean that you can't live a productive or healthy lifestyle or life. Very important is empowering yourself with information, because once you are aware about the condition, aware of the complications that it can cause, then it'll be a less intimidating condition to face or condition to accept. Accepting the condition is also, accepting the diagnosis is also very important, because sometimes we have persons like, oh, hey, I'm not accepting it, and then they, although they have been diagnosed, they refuse treatment, refuse care, and then we see them a couple of months or years later at point of complications, right? So basically come to the point that, hey, this is the reality of it, I'm going to accept the diagnosis and just basically deal with it. So empowering yourself with information is very important. Also, I spoke about also to having your checks done. So if you have, for example, I encourage my patients to have get their own glucose monitor. So for example, you can have your checks done at home, because you touch base with the healthcare system not at intervals. But if you have your monitor at home, you can be monitoring sugars, so you have an idea of exactly what's happening. And then you'll be at a better place in terms of taking care of yourself, and taking care of your health.
Definitely. Right? What type of services do we offer here at BVI-HSC that persons can access?
Okay, so persons can go to any of their nearby community clinics, whether here on Tortola or any of the sister islands. Once you come into the clinics, we can do your baseline evaluation, your baseline checks. We go through what your risk factors are, to see if you're a high risk, depending on what issues you may have on that particular day. You may need further evaluation in terms of probably physical examination, lab work, etc. We do have our chronic disease clinics, and also a diabetes clinic that we have an internist that's coming on board to the team who's actually specializes in endocrinology. That would only strengthen our team. Also, we have a nutritionist, a part of the primary care system. So if we have individuals who are diagnosed, then we can actually refer for additional support or an nutrition consult, because it's a whole team-based approach. It's not just an individual and medication, but we're talking about general healthy eating. That's a very, very important part of it as well.
Mm-hmm. And how can persons access this care?
So again, I mentioned you can go to your nearest community clinic. You can call the general hospital. Normally, if you don't, I'm not sure of what the number for your closest clinic is. We always advise that it's better for persons to make appointments. It's easier for you to get through, and also with the COVID, and we're trying to limit the number of persons on waiting areas now. But we still, if you want to accept walk-in patients, is not a problem. So if you come in or call in, then we schedule a visit, to see the nurse, have your checks done, see the physician, have an evaluation done. And it's as simple as that.
Wonderful. Well, we want to thank Dr. Alaire Khan Fraser for coming on the program today and sharing with us some very vital information regarding diabetes awareness. Dr. Fraser, with your final couple of minutes, tell us a little bit about the challenges, some of the challenges that you have with your diabetic patients, and basically tips to leave them with.
Okay. As I said before, if you're being have not had a diagnosis of diabetes, the important thing is, if you have the risk factors I mentioned before, to address these. If these are modifiable, if you're overweight, you lose weight, address if you're not eating properly, not exercising, very important to address. If you have been diagnosed with diabetes, you can live a healthy, productive life, be adherent to your medications, your wellness, your visits with your physician, very, very important. Doing your own monitoring at home, empowering yourself with education, because once you understand the whole process, how this disease can affect your body, then I think persons may be more prompted to take care of themselves. A lot of times there's a lot of misinformation, and persons don't really have a clear understanding of what the condition is about, and then that's when we find that persons who say, oh, I'm not going to accept the diagnosis, or I'm not going to use my medication regularly, I'm not going to eat properly, because they understand how this can affect them and the complications that can be so detrimental. So as mentioned before, in terms of worst case scenarios, going blind, kidney disease leading to dialysis, or even amputations, right? And even for loss of productivity then. Right, for example, if individual leads as an amputee, and I say you can have a healthy life or active lifestyle still, but in terms of somebody who's on dialysis, it affects their their productive years. So it's very important to just embrace it if that is a diagnosis, and know that you can still live a healthy and productive life.
Wonderful. Thank you very much.
You're welcome.
We want to thank our viewing audience for tuning in today. Remember, knowing is half the battle, and Dr. Fraser has shared some very vital, important information with us today, and we encourage you to share it with a friend, someone you know who is affected or might be predisposed to diabetes. Share this information. Once again, thank you for tuning in. Reporting for the BVI Health Services Authority, I am Marketing and Communications Manager Natasha Letsom. Thank you for tuning in.